18-year male patient presented with pain and swelling in the middle finger of the right hand. X-ray done. There is a broad-based ossified mass lesion in the proximal third middle phalanx at lateral ventral surface, predominantly involving metaphyseal and diaphyseal region. Lesion contiguous with cortical surface of the underlying bone without definitive medullary continuity or involvement. Margin shows thick irregular surface, mild paraosteal reaction and mild soft tissue thickening. No evidence of cortical breach. Lesion shows narrow zone of transition. X-ray findings are in keeping with non-aggressive bone lesion at lateral ventral surface of the proximal third middle phalanx. No bone fracture. Subsequent ultrasound. Ultrasound shows ossified mass with mild surrounding soft tissue thickening seen. Adjacent interphalangeal joint, tendon and ligament appears normal. No interphalangeal joint effusion. Comment. Ultrasound and X-ray findings are in keeping with non-aggressive bone lesion in the proximal third middle phalanx of the right hand, likely bizarre paraosteal osteochondromatosis (BPOP) or Nora lesion. DD. Florid reactive periostitis. Suggest. Orthopedic opinion. Discussion. Bizarre paraosteal osteochondromatosis. It is exophytic osteochondral lesions which have an appearance similar to an osteochondroma and are typically seen in the hands and feet. On imaging, BPOPs are shown to be continuous with the underlying cortex, but usually without continuation of the medulla. BPOPs are most often seen in young 20 to 30-year-old patients. There is no recognized gender predilection. Radiographic features. Plain radiograph. Typically seen as a well-marginated wide-based bony growth projecting into the soft tissues, although often lacks the characteristic orientation away from the nearby physis seen with osteochondromas. The mineralizing exophytic lesion arises from the cortical bone with or without osteolysis, cortical flaring or a periosteal reaction. A lack of medullary involvement is characteristic of bizarre paraosteal osteochondromatous proliferation, although radiographic features alone cannot reliably diagnose the lesion. Treatment and prognosis. Bizarre paraosteal osteochondromatous proliferations are benign lesions with no risk of distant metastasis, but they may show marked local invasion and may recur after surgical excision. Differential diagnosis include osteochondroma, periosteal chondroma, paraosteal osteosarcoma, periosteal osteosarcoma, periosteal chondrosarcoma, florid reactive periostitis, turret exostosis, subungual exostosis.